Welcome to Dental Health 365. What are dental aligners? Dental aligners are clear, removable orthodontic devices used to straighten teeth. Unlike traditional braces, aligners are nearly invisible and can be taken out when eating or brushing. They are custom-made to fit your teeth and gradually move them into the desired position over time. How do dental aligners work? Aligners work by applying gentle, consistent pressure to your teeth. Each set of aligners is designed to make slight adjustments to the position of your teeth. You'll switch to a new set of aligners approximately every 2 weeks, and each set will continue the process of moving your teeth into alignment. The aligners are created using advanced 3D imaging technology, which ensures a precise fit and effective treatment plan tailored to your specific needs. Benefits of dental aligners. Benefit 1. Nearly invisible. Aligners are clear, making them a discreet option for orthodontic treatment. Benefit 2. Removable. You can take them out when eating, drinking, brushing, and flossing, which means no dietary restrictions and better oral hygiene. Benefit 3. Comfortable. Made from smooth plastic, aligners are comfortable to wear and less likely to cause irritation compared to metal braces. Benefit 4. Convenient. With fewer dental visits needed for adjustments, aligners offer a convenient way to straighten your teeth. Benefit 5. Effective. Aligners are effective for treating a variety of orthodontic issues, including overcrowding, spacing, and certain bite problems. Dental aligners versus traditional braces. Aligners are more discreet and comfortable compared to traditional braces. While traditional braces are fixed to your teeth, aligners can be removed, providing greater flexibility and convenience. With aligners, there are fewer dietary restrictions, and maintaining oral hygiene is easier since you can brush and floss normally. However, traditional braces may be more effective for treating severe orthodontic cases. Who can use dental aligners? Aligners are suitable for teens and adults with mild to moderate orthodontic issues, such as crowding, spacing, and minor bite irregularities. They are not recommended for severe orthodontic cases or very young children. A consultation with an orthodontist will help determine if aligners are the right choice for you. Do dental aligners suit everyone? While dental aligners are a great option for many, they may not be suitable for everyone. People with severe orthodontic issues, such as large gaps, very crooked teeth, or significant bite problems, might require traditional braces or other orthodontic treatments. Additionally, those who are not diligent about wearing their aligners for the recommended 20 to 22 hours per day might not achieve the desired results. It's essential to have a thorough consultation with an orthodontist to determine if aligners are the right fit for your specific dental needs. The treatment process. Step 1. Initial consultation. During the initial consultation, your orthodontist will assess your teeth and discuss your treatment goals. Step 2. 3D imaging and customization. Your orthodontist will take 3D images of your teeth to create a customized treatment plan and design your aligners. Step 3. Receiving the aligners. Once your aligners are ready, you'll receive a series of aligners to be worn sequentially. Step 4. Wearing the aligners. You'll need to wear your aligners for 20 to 22 hours a day, removing them only for eating, drinking, brushing, and flossing. Step 5. Regular checkups. Regular checkups with your orthodontist will ensure your treatment is progressing as planned. These appointments are typically every 6 to 8 weeks. Step 6. Completing the treatment. Once your treatment is complete, you may need to wear a retainer to maintain your new smile. 8. Tips for success with dental aligners. Tips for a successful treatment. Wear aligners for 20 to 22 hours daily. Consistency is key for effective treatment. Clean aligners regularly. Rinse them with water and clean them with a soft toothbrush and mild soap or an aligner cleaning solution. Follow your orthodontist's instructions. Adhering to the treatment plan and attending all scheduled appointments will ensure the best results. Avoid eating or drinking anything other than water with aligners in. This helps prevent staining and damage to the aligners. Be patient and consistent. It takes time for aligners to move your teeth into the desired position, so stick with the treatment plan for the best results. Common questions about dental aligners. How long does treatment take? Treatment duration varies, typically 6 to 18 months, depending on the complexity of the case and the patient's adherence to the treatment plan. Are aligners painful? Initial discomfort is normal, but usually subsides within a few days as your mouth adjusts to the aligners. Can I eat with aligners in? No, remove them while eating to avoid damaging the aligners and to maintain oral hygiene. How do I clean my aligners? Use a soft toothbrush and mild soap or aligner cleaning solutions to clean them daily. Avoid using hot water, which can warp the plastic. I hope this video gives complete guide about aligners. Thanks for watching. Subscribe to Dental Health 365 for more dental tips and information.